So I'm going to start by sharing my screen and coming up with just the first couple of introductory slides. And so you know that we're going to be talking about the confusions, the concerns, and the changing paradigms. It's a course that we've been doing for some years now, barring a couple of years in between. The faculty is our past masters at this from all across the country, and we'll be introducing them as the course proceeds. Where is the... So this is how the course is constructed. We're going to start with just a couple of slides on the DEWS 2 and what is new with COVID-19. This course is known for the fact that it modifies its content each year based on whatever is new and whatever is happening. What's troubling your patient is going to be addressed by Dr. Quresh Muscati, who is not here physically, but he's been kind enough to send us his slides and his talk. The OSD Masquerades by Dr. Umang Mathur from Delhi. I will be taking up hyperosmolarity and osmoprotection, and this will be followed by Professor Vanati from the RP Center, who will be telling us about how to choose the appropriate artificial tears, and meibomian gland dysfunction by my colleague, Dr. Rajiv Mukherjee from Delhi. Professor Rajesh Sinha from AIIMS will tell us about post-surgical dry eye disease and the new molecules, chloroquine, levetiracetam, and ribamipide, and cyclosporin, which has now come to stay as an important molecule in our management of inflammation, is going to be again taken up by Dr. Vanati. And finally, Dr. Rohit Shetty from Bangalore is going to be telling us about inflammation and dry eye and the role of vitamin D and his work specifically, which is phenomenal. So just to get onto the definition of DEWS, which was given by DEWS of dry eye, it's a multifactorial disease. It involves tear film instability and potential damage. There is hyperosmolarity and inflammation of the ocular surface. So this was the 2007 definition. And in 2017, what has changed in this definition? So one can see that multifactorial disease is still there. There is tear film instability, hyperosmolarity, inflammation, and damage, which is still there in the definition with the presence of ocular symptoms and visual disturbance. But the loss of homeostasis of the tear film and the addition of neurosensory abnormalities which play etiological roles has been added. So this inflammation, hyperosmolarity, and tear film instability, along with other factors, was the part of the key events that were happening to perpetuate and or to create a dry eye. And now, of course, it's become far more complex, with asymptomatic and symptomatic patients being added, those with signs and those with symptoms only. And at the end, there are people like people with neuropathic pathologies, with pain, which are the newer understandings, the neurotrophic conditions with dysfunctional sensations. These are the new things that have been added in the definition, and the spectrum has become much wider and far better now than it was a decade ago. Just a slide on the impact of COVID, and I thought this was appropriate. This has led to an increase in the prevalence of dry eye disease, especially amongst the younger people. There's an increased screen time with excessive evaporation of tear fluid. There's prolonged blinking and intervals, and there is a lot of gazing. Studies have shown that an hour of tablet or smartphone use increases the eye strain and the blur by as much as 5 times. The other potential issue has been the widespread use of face masks, which adds another dimension to the whole thing. So the displacement of the mask or an incorrectly fitted mask will disperse air around the eye, and this air leakage and flow adds to what we call MADE, or mask-associated dry eye disease. So I'm going to go on now and go to the next speaker, who is going to be Dr. Quresh Muscati, and I'm going to continue to share my slides and go ahead and present his talk.